Kia ora team, my name's Ben and today we're going to go through the massage consultation or the pre-massage screening interview. So we got 4 goals we want to achieve with this. The first one is we want to build rapport with our client and we want to empower the client, we want to make a plan, and then we want to get consent. Many people are intimidated by a medical or clinical situation. So the first thing we want to do is try to break down those barriers to make our client comfortable. So when they enter the room or when you bring in the room, be aware of your posture and where you're sitting or standing. We don't want to have an aggressive or stand over our client. We want to be on their level or even just lower while we start our conversation. Kia ora, my name's Ben. Take a seat. What's your name? It's good to meet you. Have you had a massage before? That's fine. What we're going to do is I'll ask you some questions, then I'll have a look at how you're moving, and then we'll make a plan of what we can do today. Have you filled in the pre-screen form? Awesome. Thank you very much. So just checking, do you have any medical problems at all? And are you on any medications? And do you have any allergies? So even though they've filled in the form and you've got all this information in your database, it's good to double check because some people aren't so good at filling in forms, and maybe you asking them will prompt them to remember things that are important that you may need to consider when you're doing your massage, or maybe a contraindication to stop you or prevent you from doing a massage. So what brings you in today? So now we listen, we ask open-ended questions, and we want to tease out exactly what's going on. So things to ask, the site of their symptoms, where are they? And sometimes it's good to ask them to point to them, and then you can point on yourself just to clarify, because what some person says is hip may mean buttock or glutes or low back to someone else. Then we want to look at intensity. So on a scale of 0, no pain, to 10, worst pain in the world, how would you rate your pain? Then the nature of their pain or their tightness. Is it sharp? Is it dull? Is it aching? Are there pins and needles, numbness? How would you describe it? Then we want to determine the stage. Is it acute, like just happened recently? Because maybe it's too early to begin massage therapy. Or is it chronic? And is it getting better, worse, or staying the same? And then we want to see what makes it better and what makes it worse. What activities, the time of day, any more information they can provide. So the next thing is we want to see how they move. So whatever their affected area is, we want to get them to go through the range of motion and then rate their discomfort from 0 to 10. So seeing if there's tightness, if it's limited, or if it's just painful and stiff. So once we've got this information, we've got a bit of a plan forming in our head, we want to be clear that our plan matches theirs. So we can ask, so just to be clear, what do you want me to massage today? And if they respond with low back, we want to really clarify what that means. How far up would you like me to massage, and how far down would you like me to massage? Does that include your hips and your glutes? So show me where you want me to go. In doing this, we want to make sure that we're totally aware of the client's expectations, so there's no misunderstandings. Massage is best done skin to skin, but if you're not comfortable with that, you can remain fully dressed. So in a moment, I'm going to go out and wash my hands, and then you can remove whatever layers of clothing you feel comfortable with. So some people can be fully undressed and they're going to lie under the draping and will cover you up. Other people feel like they'd prefer to leave their underwear on. That's entirely up to you, or again, you can remain fully clothed. If you want a deep tissue massage, then sometimes it can be a little bit uncomfortable the next day. But remember that you're the boss of you, so I want you to let me know throughout the session if you want more pressure or less pressure, and I'll be asking you as we go along. Is that okay? And also it's important for you to feel comfortable the whole time. So if ever during the massage you feel like I'm too far in your personal space, just let me know. And also if you feel cold or hot or you feel a draft, just let me know and we can address that. Alright, do you have any questions before we start? Great. I'll leave the room and wash my hands. If you undress and lie on your tummy with your face in the hole and then pull that draping over the top of you, and then I'll knock on the door before I come in. All right?